they've done excellent care for me. I've healed, my wound is healed, and I have no complaints.
My name is Dr. Qadri. I am dual trained in general surgery as well as internal medicine, and I have been fortunate to be the CEO of Crescent Wound Care since 2021. So at Crescent Wound Care, we ensure that a specialized wound surgeon need to be involved in wound care. It concerns us when we see that our vulnerable wound patient at nursing home receive wound treatment through non-specialized physician and oftentimes non-physician provider. Hence at CWC, only specialized wound surgeons are practicing wound care, and that ensures the best outcome.
You know, we do get asked this question a lot, if an actual surgeon will be coming to make rounds in the facility, and our answer is always yes. An actual physician surgeon will be coming to the facility to make rounds. We do our due diligence. We are very selective and particular about who are we going to hire. We prefer physicians with surgical backgrounds. We do not hire mid-levels. We do not have any PAs or nurse practitioners in our group.
The day our doctor starts coming in, you will learn how efficient we are. Your treatment nurses will absolutely love those doctors because that's how easy these doctors are. People love them. I get phone calls from new facilities. They ask, can we have Dr. Zah in our facility?
It's such a fascinating field. You get all these variations of wounds, and patients tell me, wow, somebody told me like this will never heal. And then, I got to heal that. That makes, not just me feel great, but I know the patient's very happy. So that's what makes it a great field.
I think there's one patient I saw that has been treated for 2 years. I think within a few weeks we were able to reduce that wound by 80% size. And I think, every time she sees me, she remembers, she almost lost a leg, but, with consistency and sound clinical judgment, we're able to help her save that limb.
My favorite part really is knowing that I'm going to be able to provide something unique. And then on top of it, I'm able to provide a layer of support for the nurses who are they're our frontline providers. Like they're there 24 hours a day and they work really hard. And a lot of times they just need somebody to stand behind and say, like, I got it. I got you, right? I'm here to provide you the answers and help you.
What sets Crescent apart from others? They're there anytime you need them. They are very people-oriented individuals. They're just very easy to work with. They work alongside of you. They don't work over you. They walk you through the situations. They're just easy to work with.
It was the first time I had no pain, and that was wonderful. That was wonderful not to feel that agony. I had this pain for about 6 months. Due to their health and care, I got better, and I appreciate it so much.
Our goal is to provide the care that I would expect for my own family member. At Crescent Wound Care, we strive to implement evidence-based and cost-effective solutions without compromising the quality and safety of our patients.
What we do different is actually incorporating the clinical expertise with sound clinical science. I mean, what does the science say about that? Every time we see a wound that needs to be debrided surgically, we're not afraid to do it, and I think that helps the patient a lot.
I would say Crescent has been very good as far as attending to the complexity of the patients we have. We as a facility do have very complex patients. We directly related to the main hospital and we admit broadly. So we do need that type of expertise that Crescent is able to provide us to move them through the pipeline and make sure they're healthy at the end.
It's unfortunate that not everybody can, understand the wound and treat the wound. But if you come to the right person, the right specialist, there are so many different types of treatments, a lot of things that can be done, to minimize, if not healing the wound completely.
I think Crescent Wound Care is the foundation of care for people who have chronic diseases and who are in a bad spot. Like, we're here to make your experience better and hopefully to get you home with no wounds. Like, that's what we're about.
I would appreciate all your care, all the care you gave me, and the consideration and thoughtfulness that you gave me. And thank you very much for helping me to get better.